Parasomnias. Part 1, Classifications. Parasomnias are all the abnormal happenings while a person is asleep, apart from sleep apnea. Some examples include sleep eating, sleepwalking, nightmares, sleep paralysis, sleep sex, and sleep aggression. Parasomnias affect about 10% of Americans. Children are often affected more than adults because their slow wave sleep is longer. For this reason, they often grow out of it. Parasomnias occur during non-REM sleep and generally occur during the first third of the night. There may be a genetic component. It tends to run in families. Sleepwalking specifically has been tied back to the DQB1 gene. Confusional arousals, or when somebody is woken up unexpectedly, such as someone who is on call, a doctor. Their speech will often be slow or slurred. It doesn't make a lot of sense. Their speech is illogical, and they have no memory of this the next morning. Treatment for this includes strong sleep hygiene, and it's important to be aware of this issue if you need to wake someone up. Sleepwalking. The person will not remember the sleepwalking event, and the person will be difficult to wake in the event. The events usually start with sitting up and then continue into walking. It could turn into running and even a more serious driving. Their eyes will be open and the person will usually not be able to communicate. Treatments for sleepwalking include protection from harm, so making sure that the doors and windows are locked. Keep the sleep area free of harmful, sharp, or heavy objects. Be sure to cover windows with heavy drapery and place an alarm on the sleepwalker and door. Hypnotherapy can also be beneficial for some people. Scheduled awakenings during the night, medications by a doctor if needed, and also practicing relaxation techniques. Night terrors. A person with night terrors will typically scream, cry, and have a general sense of fear during sleep. They experience increased heart rate, increased respiratory rate, and sweating may be seen. Children usually occur during the first third of the night, and adults can happen any time of the night. Treatment for night terrors can include increasing sleep time, improving their sleep hygiene, scheduling sleep awakenings, medication, and also hypnosis. Sexsomnia. Patients who suffer from this will likely not remember when they awake. They may want to perform sexual activities that they do not normally participate in. They may have a prior history of sleepwalking. Males tend to be more physical and include sexual fondling or intercourse, and females tend to be more vocal and masturbate. Treatments for sexsomnia include avoiding alcohol and other substances, decreasing stress and practicing relaxation techniques. Therapy for prior or past traumas may be beneficial, and also medication by a physician if needed. Part 2, REM-associated parasomnias. For most people, dreaming is purely a mental activity. Dreams occur in the mind while the body is at rest, but people who suffer from REM sleep behavior disorder, or RBD, act out their dreams. They physically move limbs or get up and engage in activities associated with waking. Some engage in sleep talking, shouting, screaming, hitting, or even punching. Some even fly out of bed while sleeping. RBD is usually noticed when it causes danger to the sleeping person, their bed partner, or others they encounter. Sometimes ill effects such as injury to self or bed partner sustained while sleep trigger a diagnosis of RBD. The good news is that RBD can usually be treated successfully. What we call sleep involves transitions between 3 different states: wakefulness, rapid eye movement, or REM sleep, which is associated with dreaming, and non-rapid eye movement, NREM sleep. There are a variety of characteristics that define each state, but to understand REM sleep behavior disorder, it is important to know that it occurs during REM sleep. During this state, the electrical activity of the brain, as recorded by an electroencephalogram, looks similar to the electrical activity that occurs during waking. Although neurons in the brain during REM sleep are functioning much as they do during waking, REM sleep is also characterized by temporary muscle paralysis. In some sleep disorders, such as narcolepsy and parasomnias, like REM sleep behavior disorder, the distinctions between these different states breaks down. Characteristics of one state carry over or invade the others. Sleep researchers believe that the neurological brain barriers that separate the states don't function properly, though the cause of such occurrences is not entirely understood. Thus, for most people, even when they are having vivid dreams in which they imagine they are active, their bodies are still. But persons with RBD lack this muscle paralysis, which permits them to act out dramatic and/or violent dreams during the REM stage of sleep. Sometimes they begin talking, twitching, and jerking during dreaming for years before they fully act out their REM dreams. REM-associated parasomnias include REM behavior disorder, nightmares, recurrent isolated sleep paralysis. REM behavior disorder. If you think this is a possibility, a sleep specialist neurologist should be considered. This occurs during the second half of the night or the early morning. This enactment of a dream can be very complex with vocalizations and complex movements. A person can injure themselves or their bed partner. Their eyes will be closed, and it will end with the person being awake and alert. This is most commonly seen in males over 60 years of age. Sleep paralysis. This can occur at sleep onset or upon waking. The person cannot move their extremities or head. The person may recall their dreams. Usually starts during your young adulthood. Poor sleep hygiene can contribute to this. The treatment for sleep paralysis is consider adjusting your wake time, and it can be associated with other disorders or medication side effects. Nightmares. Nightmares occur later in the night or early morning. It is usually scary, and the person can feel they are in imminent danger. The person can usually describe the episode. Recurrent nightmares can result in sleep avoidance, insomnia, and anxiety. Treatment for nightmares includes relaxation techniques prior to bed, image rehearsal, so holding an image that is calm and soothing in the mind before sleep, and also better sleep hygiene. Part 3. Other parasomnias. Other parasomnias can include enuresis or bedwetting, sleep-related groaning, exploding head syndrome, sleep-related eating disorder, and sleep-related hallucinations. Enuresis occurs in children over 5 years of age. It usually occurs the first third of the night. Primary enuresis is when the person or child did not develop bladder control. This usually has a family history. Secondary enuresis occurs when no bedwetting has occurred for at least 6 months usually in adults who had primary enuresis during childhood. It is usually caused by other sleep or health issues. Treatment for enuresis can include bladder training, setting alarms, and also medications if needed, prescribed by your physician. Sleep groaning. This occurs during exhalation. Although the person who is doing it may not know it, the bed partner will. The patient may have a slow respiratory rate, and it may occur in clusters. And there is no specific treatment for sleep groaning. Exploding head syndrome. Exploding head syndrome is the transition between the different sleep states. It is the loud imagined sound that occurs while the brain is transitioning from wake to sleep. There may be a body jerk or a light flash or a sense or fear that they are falling with exploding head syndrome. This is completely normal, but it does occur with some people. There's no treatment necessary as this is natural. Sleep-related eating disorder. This can occur multiple times during the night. A person will arouse, not necessarily fully awaken, and eat or drink. The individual is usually unaware of this behavior, and it occurs due to severe stress or when discontinuing an addictive behavior, such as smoking. The treatment for sleep-related eating disorder is to treat the disorder that is disrupting the sleep, and relaxation techniques, and proper sleep hygiene. Sleep-related hallucinations. These occur during the transition from wake to sleep or from sleep to wake. They can be visual, auditory, or tactile. A person may also experience sleep paralysis. Treatment for hallucinations may involve consider adjusting your wake time. It can also be associated with other disorders or medications. Part 4, other issues associated with parasomnias. Medications can contribute to parasomnias. Alcohol consumption will contribute to disorders that are associated with fragmented sleep. Sleep hygiene and stress contribute to these disorders and its severity. Many of these disorders have familial ties. You are now ready for the next module.